Welcome and thank you for joining the California Asthma Control Strategies webinar series. In this webinar, we'll discuss the Asthma Management Academy and its evaluation. My name is Natalie Sacramento, and I coordinate the Asthma Management Academy, a statewide asthma self-management education program for community health workers as part of the state asthma program, California Breathing, at the California Department of Public Health.
Hello, everyone. Thank you for joining us today. My name is Amy Smith, and I'm the evaluator for California Breathing.
Good morning, everyone. My name is Elena Peterson, and I will be monitoring all of your questions within the chat.
California Breathing developed this three-part webinar series to review asthma control strategies in California. Last month, we reviewed the burden of asthma and how we use asthma surveillance data in our programs. The recording will be available soon and will be posted on the California Breathing webpage. Today, we'll review the Asthma Management Academy and its evaluation. And lastly, in November, we'll present an assessment of asthma control strategies currently provided by California clinical and non-clinical stakeholders. The objectives of this webinar are to, number one, introduce the Asthma Management Academy, number two, present asthma evaluation results, and lastly, and very important to us, we'll gather feedback from you, the participants, on how California Breathing can improve the Asthma Management Academy and its evaluation efforts. This information helps our program improve, so please stick around until the end so we can get your feedback. And feel free to type any questions during the presentation in the chat. We'll be answering them during our question and answer sessions. Before we talk about the Asthma Management Academy, we'd like to introduce the state asthma program, California Breathing. We focus on asthma surveillance and developing interventions that improve asthma self-management education and environmental conditions that cause or exacerbate asthma in the most burdened populations in California. One way to address asthma is through community health workers, also known as CHWs. CHWs are trusted members of the community that leverage shared experiences and linguistic and cultural relationships to bridge their community and health services. Within documented asthma interventions, CHWs provide home visits, deliver self-management education, and assess homes for environmental triggers. As peer-reviewed and public health practice literature suggests, families that receive self-management asthma education from CHWs or other peer educators like promotores de salud experience improved health outcomes, including reduced asthma-related emergency department visits and hospitalizations, better medication adherence, reduced missed work or school days, increased confidence to self-manage their asthma, and the ability to identify and reduce asthma triggers. We'd like to see who's in the virtual room with us here today and whether you've participated in the Asthma Management Academy in the past. We have a quick poll that we'd love for you to take. So we'll take a minute here. Please answer. Number one, which of the following best describes your job title? And number two, have you attended the Asthma Management Academy? And if you typed in other, it'd be great to type that in the chat so we have a sense of that. Okay, let's see. Are we seeing the results yet? I think so. I think about 50% of folks in the room are CHWs. We have a couple of healthcare professionals and 17% are asthma program coordinators or managers. And it looks like almost half of you attended the Asthma Management Academy in the past. So thank you so much for taking that poll. All right. So what is the Asthma Management Academy? Because of the evidence that shows the role that CHWs can play in improving asthma health outcomes, California Breathing developed the Asthma Management Academy in 2017. The Asthma Management Academy, or AsMA, spelled ASMA for short, is a no-cost, peer-to-peer professional development training for community health workers and other health educators of the asthma care team. Through the Asthma Management Academy, community health workers can receive 20 hours of evidence-based training and skill building on asthma self-management education to clients and families with asthma, how to conduct an in-home trigger assessment, and review best practices for asthma home visiting. The AsMA has two goals. The first goal is to reduce the asthma burden in the most impacted communities in California, which we define as the communities that fall above the 75th percentile in asthma-related emergency department visits. Emergency department visits and hospitalizations are strong indicators of uncontrolled asthma. The second goal is to provide culturally and linguistically appropriate professional development for CHWs. Our recruitment efforts for the AsMA the last 4 years primarily involved organizations that have community health workers and other health educators that provide asthma self-management education, also known as ASME, to patients or clients with asthma. Our team spoke with the interested organizations to see if the Academy was a good fit. If the Academy was a good fit, then we invited the CHWs from the partner organizations to fill out a registration form, and we scheduled an asthma training with them. While the training is no cost for participants, we do have a memorandum of understanding data sharing agreement with partner organizations for them to provide de-identified client asthma outcomes data if feasible. The client level data are used to measure the impact of the Asthma Management Academy. Amy will talk more about the different data that we collect later in the presentation. Since 2017, we've had 68 partner organizations participate in the asthma trainings. 43% are federally qualified health centers, 26% are community-based organizations, 13% are managed care organizations, and the rest are made up of health departments, hospitals, clinics, nonprofits, and one school-based health center. The Academy is committed to decreasing the asthma burden in the most impacted communities. This slide shows the asthma burden and the Asthma Management Academy activities that we have done. Looking at the map legend here on the right, the lines show the California county boundaries. The red shading shows the census tracts that are above the 75th percentile in asthma-related emergency department visits for all ages from 2015 to 2017. The yellow star shows where our training partner, Comité Cívico del Valle, is located, which is down in Imperial County. The purple star shows where our past training partner, Esperanza Community Housing, is located, which is in Los Angeles County. The gray shading shows the coverage areas of managed care organizations trained through the Asthma Management Academy, and the blue dots show the different asthma partner organizations throughout the state. Going to the California map, here on the left side of the slide, we prioritize Academy partner organizations serving communities in these different red census tracts. In the first 2 years of the project, we focused our efforts in Southern California, which is home to more than 60% of the state's population. Looking again at our map of census tracts, it's clear that there is a high burden of asthma in the Central Valley. So we focused the last 2 years in the Central Valley. For Northern California counties, we are excited to have recently partnered with a health plan that provides care to many of the Northern California counties. Since 2017, we've had 501 asthma participants from the 68 organization. This pie chart here on the right shows the breakdown of the job titles asthma participants have. This blue piece right here represents CHWs or other health educators, which make up 68% of the pie. The red represents licensed clinical professionals, including medical assistants, which make up 13% of the pie. The green represents asthma program coordinators and managers, which make up 12% of the pie. And the purple represents asthma participants that we did not have job titles for, which is 7% of the pie. This graph shows the types of organizations that the asthma participants are from. Organization type is on the horizontal axis, and the percentage of asthma participants is on the vertical axis. The percentage is also shown at the top of each bar, right here. And the actual number of asthma participants from each organization type is shown at the bottom of each bar with N equals. From looking at the graph, we see that 48%, or 238 asthma participants, were from federally qualified health centers. 22%, or 112 asthma participants, were from community-based organizations. 16%, or 76 asthma participants, were from managed care plans. And 8%, or 41 asthma participants, were from local health departments. 6%, or 33 asthma participants, were from other organizations, including hospitals and clinics. We wanted to do a special shout out to an important partner this past year, which is the Asthma Mitigation Project. The California Department of Healthcare Services awarded the Asthma Mitigation Project contract to the Center at Sierra Health Foundation. This statewide program provides $12 million in funding for grantees, plus additional support through technical assistance and evaluation services for local health departments, medical providers, and community-based organizations to offer culturally and linguistically appropriate asthma home visiting services to individuals with poorly controlled asthma, with a focus on low-income communities and communities of color that have disproportionate rates of asthma. There were 2 funding rounds, one in August 2020, and the second funding round was in August 2021. A total of 28 organizations were funded from both rounds. So far, the Asthma Management Academy has trained over 50 CHWs from the Asthma Mitigation Project. Many of the Asthma Mitigation Project program partners are new to asthma, and we are happy to provide trainings to these new asthma home visiting programs. Now I will talk about the Asthma Management Academy training details, so you have an idea of what goes on during the trainings. The Asthma Management Academy would not be the great training program it is today without our training partner, Comité Cívico del Valle, also known as CCV. CCV is a community-based organization based in Imperial County that has been doing asthma prevention work, including asthma home visiting programs for almost 2 decades. Their CHW trainers are the ones that bring the passion, community perspective, and experience to the academy. Starting from the left here is Esther Bejarano. She is the lead trainer and joined by Marta Ponce and Ana Luisa Pedrero. I also wanted to mention Isame Pasillas, who joined the CCV training team recently. So big thank you to the CCV team. The Asthma Management Academy uses a curriculum that was developed by the Association of Asthma Educators. The curriculum is called Asthma Education for the Community Health Worker. It was carefully designed and reviewed by over 35 asthma educators around the nation to ensure participants receive a high quality, evidence-based curriculum specifically for CHWs. The training also reinforces national guidelines-based asthma care, also known as EPR3. The training uses the peer learning model, so CHWs train other CHWs. A certified asthma educator, also known as an AEC, is also part of the facilitation training team to provide asthma technical and clinical subject matter expertise. The curriculum was designed to be highly interactive using adult learning theory because people learn best by doing. There's also a skill-based testing component, a competency test, which I will talk about later. When the participants go through the academy, they go through 5 modules from the Asthma Education for the Community Health Worker curriculum. Module 1 covers the basics of asthma. Module 2 covers trigger identification and reduction. Module 3 covers medications. Module 4 covers medication delivery devices. And Module 5 covers assessment and monitoring. There are 2 additional modules that we at California Breathing developed, and they specifically cover asthma home visiting. The 2 modules are how to conduct an in-home trigger asthma assessment and best practices for home visiting. As I mentioned earlier, the Academy is highly interactive. Before the pandemic, the trainings were only in person. Because of the pandemic, CCV and California Breathing worked hard to adapt the training into a virtual one, and the CCV team uses the Zoom platform. And even over Zoom, CCV has been able to maintain an interactive training. In the virtual format, there are a lot of breakout room discussions, role plays, scenario activities, and poll questions. One of the main interactive activities is for the asthma participants to learn how to do the teach-back method for 5 common asthma medication delivery devices. The teach-back method is a way of checking understanding by asking patients to state in their own words what they need to know or do about their health in a friendly way. Literature shows that most people with asthma use their asthma inhaler incorrectly. Asthma participants are taught how to conduct teach-backs so that they can in turn use the teach-back method during their asthma self-management education sessions with their clients and families with asthma. In its current form, since the beginning of this year, the asthma training provides about 18 to 20 hours of training over 3 days and covers 7 modules. It's available in English or Spanish. Our training partner CCV is bilingual in English and Spanish. We keep the training cohort small at 10 to 15 participants so that it can be full of interactive activities. And as I mentioned earlier, the trainings are live virtual trainings over Zoom. Another benefit of the Asthma Management Academy is that each participant receives a training kit that includes asthma demonstration inhalers, a spacer, and a peak flow meter. Participants also receive the AAE participant manual and other hard copy training materials. At the end of the training, each participant will receive a certificate of completion from us at California Breathing at CDPH. A certificate is also available from the Association of Asthma Educators, the organization that developed the curriculum. In order to receive the AAE certificate, participants can take an optional competency test after the training. The competency test is a 1-hour Zoom-based test conducted by an AEC. The AAE requires that the participant show a higher than average understanding of the information presented in the program. So the participant would need to pass with an 80% or higher. The goal is for the medical community to hold this certificate of completion earned by CHWs in high esteem to further build their confidence in having community health workers included in the asthma care team. This is not a certification exam, however, it is a certificate of completion. So as you can see, there are many components to the Asthma Management Academy training. We hope that we were able to give you a glimpse of the training or remind those who have attended the training in the past what the asthma is all about. So we just wanted to check in at this point to see if there are any questions thus far. Elena, are there any questions in the chat?
So far, I don't see any questions. We have been seeing where people, what agencies people are a part of. We have the American Lung Association, we have Minnesota Asthma Program, State of California Breathe Mobile Program. So welcome all. Everybody's welcome to comment, question. We have something here. Please talk about the package that is sent out to the participants. That was our latest comment.
Sure. So let me go back to that slide. This is the what we call the Asthma Educator training kit. And it includes demonstration inhalers. There's a MDI or meter dose inhaler, that demonstration device that participants receive. There's also a DPI demonstration device, the dry powder inhaler. And CCV has also been very creative because we don't have access to other demonstration devices like twist halers, flex halers. They've been very creative in what participants can use in this virtual platform, and they've created these cutouts of those different medications for people to practice with. In the kits, we also include a spacer, a peak flow meter, and I think CCV also provides green cleaning recipes. So there's a variety of training items in there. I hope that answered your question. Ashley, do you want to add anything?
No, you covered it. Thank you.
All right. Any other questions?
Don't see any more at this time. Any questions that were asked were answered in the chat.
Great, thank you. All right, so let me go here. If your organization is interested in the Asthma Management Academy, feel free to shoot us an email at california.breathing@cdph.ca.gov or visit our webpage at www.cdph.ca.gov/ASMA. And I think, Elena, would you be able to add that to the chat if you haven't already? Great. And now Amy will walk us through the evaluation results for the Asthma Management Academy over the last 4 years. On to you, Amy.
Thank you, Natalie. Hello again, everyone. Thank you for joining us today. Next slide, please. The asthma evaluation results presented in this webinar will focus on some select evaluations from the various evaluations done throughout the 4 years of the program. Today, we will highlight the data we collect from the asthma participants, including their knowledge, skills, comfort levels, and the asthma self-management education strategies that they provide to their clients. This is in order to measure the impact of the asthma trainings on their capacity to provide asthma self-management education, or ASME. We will also look at the data we collect from the asthma partner organizations and their client-level asthma health outcome data that we receive from them. The various evaluation tools we use to collect the data from the asthma participants are a pre-test, which is part of registration, post-test for 4 of the training modules, an in-training teach-back score, a post-training competency test with certified asthma educator, and a 3-month follow-up survey after the completion of the training series. For the client data, we collect emergency department visits and hospitalizations, improved asthma control. This is looked at through either an asthma control test or a client's self-reported improvement, as well as their controller medication adherence and how much they are regularly using their controller medications. Next slide, please. We will first focus on the evaluation results, which show an increase in capacity of the asthma participants. These evaluation data help us understand by how much the training participants have increased their knowledge, skills, and comfort levels in delivering asthma self-management education with their clients, as well as if they've incorporated new tools and methods into their strategies. We use these data to assess the impact of participants' capacity to deliver ASME, to highlight where participants might need more education and support. For example, we have provided additional training to participants on medications, as well as spirometry based on these types of evaluation results in the past. And the third thing we use it for is to inform training content and delivery and make any programmatic changes. For example, if a lot of people are getting a particular question wrong, we would look at the quality of the training for that content area, or also see if the question itself is confusing and needs to be reworded, etc. Next slide, please. This first graph shows the percentage of asthma participants who correctly answered the asthma knowledge questions, which are asked at 3 different time points. Questions are shown on the horizontal axis, and the percentage of participants answering correctly is on the vertical axis. Within each question, the different time points are represented by different colored bars. Blue bars represent pre-training prior to participating at all in the AsMA. Gray bars represent post-tests, which are taken immediately after each AsMA module, and these occur during the course of the training. And orange bars represent a 3-month follow-up after completing the entire AsMA training series. We have different numbers of respondents for each question and time point, depending on who all completed that particular questionnaire. For the first question, we will present the numerators and denominators to get a sense of the amount of respondents for each time point. The question is, what are the most common asthma symptoms? So on the far left for the first question, in the pretest, there were 269 respondents who answered the question and 229 who got it right, which equals 85% of participants getting the answer correct at that time point. In the module post-test for that same question, which is represented in the gray bar, there were 421 people who answered the question and 404 respondents who got it correct, equaling 96%. For the 3-month follow-up survey, a total of 122 respondents answered the question and 115 were correct, equaling 94%. This shows an increase in knowledge from pre to post training. The difference in the number of participants for each time point is due to the development of the pre-training and the 3-month follow-up questionnaires at a later date in the program, whereas the module post-tests were collected from the beginning for all 4 years of the AsMA. In addition, there is generally a lower response rate of approximately 30% for the 3-month follow-up questionnaire that is emailed to past participants, compared to the pre-test, which is part of registration, and the post-module surveys that are collected during the training itself. For the next question, which represents the role of quick reliever medications in asthma, in the responses to this question, we see a clear upward trend over time. More participants respond correctly to this question in the post-training questionnaire at 97%, compared to participants responding in the pre-training questionnaire at 88%. For the next one, which is what is true about long-term controller medications, we see an even larger upward trend in this question. Only 74% of participants responded correctly in the pre-training test, 95% were correct in the module post-test during the training, and 97% responded correctly in the 3-month post-training follow-up survey. For the last one, who should have an asthma action plan? This question was only asked in the pre and post-training questionnaires. The percentage of correct answers also increased from 87% in the pre-training to 89% in the post-training. Next slide. This slide represents the total average test scores for the module post-tests in training teachbacks and post-training competency tests. Out of over 400 participants, average test scores from the 4 module post-tests range from 83% for module 2 up to 94% for module 4. Higher scores of 89% and 94% were for the last 2 modules, 3 and 4. After people have completed the asthma trainings, they have the one-on-one competency test with the AEC. This competency test includes knowledge and skills taught in all the training modules. There is a rubric for scoring. The competency test scores average from 95% correct for module 5 to 98% correct for module 1. As we know from research, demonstrating or conducting a teachback about what you have just learned can reinforce information and increase knowledge and skills. This teachback practice is something that is encouraged during ASME with clients as well as a training tool. During the asthma trainings, we have 2 medication-related teachbacks for participants to show that they know how to use each type of inhaler and how to instruct their clients on how to use them. The medication teachbacks scored high with metered dose inhaler scores of 96% and dry powdered inhaler scores of 97%. Next slide. This graph shows the self-reported level of asthma knowledge by participants, both before and after asthma training. The level of asthma knowledge is shown on the horizontal axis and is characterized as none, very little, some, a lot, and advanced knowledge. The percentage of participants reporting each knowledge level is on the vertical axis. Responses collected prior to the asthma training are shown in blue, and responses collected after the training are shown in orange. Before taking the training, participants expressed having less knowledge about asthma, with 4% saying none, 28% saying very little, about half saying some, and only 12% saying a lot, and 3% saying advanced knowledge. Whereas in the 3-month follow-up, most participants, 61% of them, say a lot of knowledge, a whole 34% say even more advanced knowledge, and only 5% say some, with no participants from the post-training evaluation reporting very little or no knowledge. It is important to note that the actual number of respondents to the pre-training survey, which is part of registration, is about 3 times higher than those who volunteered to fill out the 3-month follow-up survey that is emailed to them. Next slide, please. This graph shows the self-reported comfort level in providing ASME by participants both before and after the asthma training. Comfort level is shown on the horizontal axis and is categorized as not at all, a little, not sure, comfortable, and very comfortable. In addition, there is a category for those who do not provide ASME. The percentage of participants reporting each comfort level is on the vertical axis. Responses collected prior to the asthma training are in blue, and responses collected after the training are in orange. We see a similar upward trend with people's comfort level in providing asthma self-management education from before the training to 3 months after the training. Over half, or 55% of participants who completed the post-training survey were very comfortable providing ASME, whereas only 15% were very comfortable at the pre-training time point. Overall, the self-reported asthma knowledge is higher than comfort levels. As we know, having the knowledge about a subject like asthma alone does not mean someone is automatically comfortable teaching others about it. This is one of the reasons the AsMA incorporates teachbacks into its trainings. When educators practice their skills in delivering the knowledge they've learned, it can increase both their capacity and comfort levels in delivering asthma self-management education to clients. Next slide, please. We also asked participants in both the pre and post-training surveys which specific ASME strategies they provide to clients who have asthma. This graph shows a variety of strategies on the horizontal axis and the percentage of asthma participants on the vertical axis. Like on the previous slides, responses collected prior to the training are in blue, and responses collected after the training are in orange. Our goal is to see this number of strategies increase as the training participants learn about different tools and the value of using them with their clients. As you can see, there's an upward trend for each topic area. After the training, 57% of participants give education on how asthma affects the lungs and breathing, whereas only 33% reported teaching about this prior to attending the training. This trend continues for all of the topics. 47% now teach about how to use inhalers post-training versus 32% prior. 56% teach about quick reliever versus controller medications versus 30% prior. 50% use asthma action plans versus 35% prior. And 29% do home trigger assessments versus 18% prior to the training. The lowest response for both pre at 14% and post at 17% was in using a peak flow meter. And overall, 38% of participants in the AsMA did not provide asthma services yet pre-training, but only 9% still did not provide any of these educational strategies post-training. Please note that the percentages here do not add up to 100% because the participants could select more than one option in the responses. Next slide, please. We also asked participants which topics they covered in their asthma teachbacks with clients. This graph displays topics on the horizontal axis and the percentage of participants on the vertical axis. Responses from before the asthma training are in blue, and responses from after the training are in orange. Once again, there's an upward trend from pre to post training for each topic area. Having clients explain back to them about how asthma affects the lungs moved from 21% to 35% post-training. Having clients demonstrate how they use their inhalers moved from 31% to 43%. Having clients explain when to use their controller medications and when to use their quick relief medication moved from 28% to 39%. And using an asthma action plan had a slight increase from 29% to 31%. Next slide. Okay, so now we will be doing a poll. So we want to ask, how do you track whether someone's asthma is under control? Do you monitor health outcomes data, such as ED visits and hospitalizations? Do you track the results of asthma monitoring tools, such as the ACT or asthma control test and the asthma action plan? You calculate the ratio of asthma medication usage between long-term controller and quick relief inhalers? And do you do a self-reported survey of clients' feeling in terms of their own control of their asthma? And if you do any other strategies to look at asthma control, please write that in the chat if you check other. Okay, so the results are in. Looks like about 49% monitor health outcomes data, such as ED visits and hospitalizations. 46% track the results of asthma monitoring through an ACT or an AEP. 41% calculate the ratio of asthma medication usage between long-term controller and quick reliever inhalers. 26% use self-reported survey of clients feeling in control of their asthma. And about 3% did other, which we can look at in the chat. Let's see. We also collect teacher report data and data on school absences. And we also compare parents' perceptions of control to ACT score and review what good control looks like. Oh, that sounds great. Let's see if there's anything else here. No, that's it in the chat. Okay. So I think we're ready for the next slide. Thank you for participating in the poll. It's great to see how everyone is using all those tools. So now we're going to shift our focus to the second column of the evaluation data that we're highlighting today, which is in client asthma health outcomes. Next slide, please. To evaluate asthma-related health outcomes for clients with asthma, we ask partner agencies to provide baseline and follow-up data for clients seen by CHWs and other health educators who participated in the Asthma Management Academy. With these data, we can identify which clients with asthma were provided ASME. We can also assess the impact of this education on clients' asthma health outcomes, such as whether they have decreased their usage of the emergency department for asthma, or their asthma is more under control after having received this comprehensive ASME. The timing of the follow-up data varies by organization. We try to get data at 6 months and 1 year, and sometimes up to 2 years, but not all organizations provide us with more than 6 months of follow-up. Next slide, please. Collecting client-level data has been one of the biggest challenges for us in California Breathing. Every organization differs in their asthma intervention, what information they collect on their clients with asthma, and how they collect it, as well as what intervals they collect it. Of 68 organizations that have participated in the Academy, 31 have provided client-level data. We currently have data on 1,405 clients enrolled in AsME programs taught by CHWs, promotores de salud, and health educators who went through the Academy. Next slide. Of the 1,405 clients with asthma enrolled in AsME programs, most were children. The data shows that 57% of the clients were children, 0 to 17 years old, 33% were adults, 18 years and older, and 10% were of unknown age. Next slide. This graph shows the race and ethnicity of these 1,405 clients. Race and ethnicity categories are listed on the horizontal axis. The vertical axis shows the percentage of clients. At the top of each bar, we show the percentage of clients in each category. And at the bottom of each bar, we show the actual number of individuals in each race and ethnicity category. From looking at the graph, we see most of the clients were Hispanic or Latino. Specifically, and moving from the left side of the graph to the right, 54% or 759 individuals were Hispanic or Latino, 19.7% or 277 individuals were Black or African American, 9.4% or 132 individuals were white, 1.6% or 22 individuals were Asian, 0.2% or 3 individuals were American Indian or Alaskan Native, and 0.1% or 2 individuals with asthma were Native Hawaiian or Pacific Islander. 14.9% or 212 individuals with asthma had unknown race or ethnicity. Next slide. These 1,405 clients represent only a subset for whom partner organizations agreed to provide data to CDPH. Therefore, the total number of clients who are served by these CHWs who have gone through the asthma is likely much higher. Of those 1,405 clients, only 545 completed at least one asthma self-management education session with an asthma-trained CHW or health educator and had any follow-up information available. So within this group of 545 clients, we can look at improvements in 3 different health outcomes. Asthma ED visits and hospitalizations is one. The next one is asthma control, which again is measured by either the ACT or self-reported improvement. And the third is controller medication adherence, or taking their controller medications regularly. Next slide. So to examine reductions in asthma ED visits and hospitalizations, we need to look at clients who had at least one of these events in the 12 months prior to enrolling in their asthma program. Of the 545 clients who completed at least one AsME session and had any follow-up, we know that 98 clients had at least one asthma ED visit or hospitalization, and the remaining 447 clients had either 0 asthma ED visits and hospitalizations, or we just do not have this information for them. We also need to have an additional 12 months of follow-up time to see improvement from the baseline. So that leaves us with 76 clients for whom we received this follow-up. Out of those 76, 65 or 86% reported reduced asthma ED visits and hospitalizations in the 12 months after AsME. Next slide. In terms of asthma control, Of the 545 clients who completed at least one AsMA self-management education session and had any follow-up information available, we have data on asthma control status at 1 month or more after the education for 255 clients. Out of those 255, 162 of them, or 64%, reported improved asthma control after AsME, which is demonstrated by increased asthma control test or the client's self-reported improvement. Next slide. For our last indicator, of the 545 clients who completed at least one asthma self-management education session and had any follow-up information available, 200 had follow-up data on control or medication use. 101 out of 200, or 51%, reported increased controller medication adherence. Increased adherence does not necessarily mean 7 days a week, and the medication adherence data we receive are both from medical or pharmacy records or are self-reported by the client, depending on the organization. So in summary, the asthma training series has a positive impact on both its participants' capacity to deliver asthma self-management education to their clients, as well as a positive impact on the asthma health outcomes of these clients who are seen by CHWs and other providers who deliver the AsME. We'll do the next slide and take any questions at this time. We'd love to have you either raise your hand and you can speak verbally, or you can put your question in the chat, whichever is more comfortable for you.
Right now, Amy, I don't see any new comments or questions. All have been answered, but definitely feel free to comment or ask questions.
Please ask away. If there's anything needs clarification on the data or any questions about how we collect it?
Looks like we have a participant asking, can you put up the slide of results again? Like 2 to 3 slides ago.
Results, which results? Let's see.
Rosa, could you clarify maybe the title or the topic or the one before this?
Of the...
Okay, it's this one. Thank you, Rosa.
Was there an additional question, or Rosa just wanted to look at that slide again?
I think she wanted to look at it, but we did get another question right after. It says, how many visits are PT getting with the community health workers?
The patients getting, okay. So in terms of how many asthma self-management education sessions are the clients or patients getting, that really depends on the organization, and every asthma program is different. So for some, it's only one session, and it can, be a few or several. So what we did for our analysis, because of that, is just say if they attended at least one. But there is variation with organizations. Did that answer your question? Any other questions, comments? Okay.
Another one just came in. Mm-hmm. What do you do with results for the assessment for triggers? Is there any remediation provided?
That's a great question. And if someone is available from the asthma program team, either Natalie or Ashley, if you want to jump in and speak to that, that would be wonderful.
Ashley? Sorry, Elena, can you repeat the question again?
Sure. What do you do with results for the assessment for triggers? Is there any remediation provided? I think we did get a comment, a response. I think there was an earlier question asking where we purchased our DPI from. That would be for Ashley. Okay.
In terms of triggers, I don't think we collect that data. Is that correct, Ashley or Jackie?
Yeah, I can go ahead and answer this. Hi, everyone. My name is Ashley Kissinger. I'm with the State Asthma Program, California Breathing. So we do collect information on whether or not organizations or the CHWs trained in the Asthma Management Academy do or conduct an environmental trigger assessment for their patients or clients. Whether there is remediation provided, that's really dependent on the organization, and that may be something in the future that we should look into collecting. But I do know in some organizations, they may provide a asthma-friendly cleaning bucket. They may provide some, kind of cockroach traps or pest control. They may provide other asthma control devices or materials, including, environmental trigger, like control devices, including a HEPA filter vacuum cleaner or like a Swiffer mop. So it's really dependent on the organization. There's lots of variation, as Amy alluded to, across organizations. And so that might be something we look into for sure in the future. Lynn, I hope this answers your question. Please take yourself off mute if you want some more clarification, or write in the chat if that was sufficient, but hopefully we're able to answer your questions. Any other questions? Thank you for.
I don't know. My name is Paul. Are y'all getting me?
Yes.
Okay. I'm just curious. This is obviously our program. Unfortunately, we've done some intake and outtake data, but nothing extensively as this. How are y'all gathering this information? I know it comes from different programs, but is it done digitally? Is it done by paper? Is it done by texting? Those are the things we are sort of struggling with.
I see. Well, I'm not exactly sure. I know there is an Excel data sheet that Jackie Wong,
well, I'm talking about how is the information gotten from the client? Is it done by an interview, or is it done, by phone interview? That's what I'm looking for.
Okay, so you're not talking about from our partner organization to us.
No, I'm just curious how these programs are getting the data that you're getting.
Hi, this is Jackie Wong. I'm the epidemiologist with California Breathing, and I deal with a lot of the client data. It really depends on every organization. Each one is different. A lot of the health plans and the larger organizations, it's all done electronically. A lot of the larger FQHCs, everything is just through the electronic medical record. And we have even worked with some organizations to add questions to their EMR, their electronic medical record. For other organizations, especially smaller community-based organizations, they may use paper forms in interviews with their clients. So it really ranges.
Yeah, that's one of the things we've been struggling for, which sustainability is important to show these kind of outcomes, because you want to see improvement for return on investment and stuff like that. But it's just a matter of this is great. This is one of the few times I've actually seen outcome data from actual clients and sort of been very specific on what's working and what's not working. That's great. Thank you.
Sure. I will just add that these data are difficult to come by, and so.
I'm sure it is.
Yeah.
By the way, I'm from Texas, San Antonio, Texas. So you do have a broad range outside of California borders.
That's great. Thanks.
It looks like we have another question from Kelly. I'm interested in hearing more about how you recruited and developed these partnerships to build this asthma self-management education program. I don't know if Ashley or Jackie, if you want to take that, in terms of how you build the partnerships and have those conversations with people. Ashley, anyone?
Sure, I didn't know who wanted to take it. I'm happy to talk about this. Hi, Kelly from Minnesota Asthma Program. I think California Breathing, we're really grateful to have a very wide, far-reaching network of asthma stakeholders. So I think when we developed the Asthma Management Academy, we were able to reach out to our networks to be like, hey, we have this great, asthma self-management education training opportunity for health educators. So we definitely leaned on some of our existing networks, especially through RAMP, the Regional Asthma Management and Prevention Program, that has a great, listserv and network. And they also house 3 statewide asthma-related coalitions, like, oh my gosh, CAF, the California Asthma Financing, the California Healthy Housing Coalition, and CAFA, the, oh my goodness, they're going, Community Action to Fight Asthma, I believe. I always forget my acronyms on the spot, my apologies. We also leveraged our existing relationships with primary care associations and community clinic consortia to pitch this, the Asthma Management Academy, essentially as a quality improvement project. Many clinics and managed care plans look to how their HEDIS measures or their quality improvement measures are performing in asthma. And so when we show that when we invest in training, educators and people on the asthma care team, especially in, a national asthma guidelines-based curricula, what kind of, what effect that might have for their organizations, that really spoke for itself. So we've been able to try and reach out to different, partners and organizations to be able to promote the Asthma Management Academy. I think one of the most, our current and maybe more significant partner at the moment is the Sierra Health Foundation, which Natalie alluded to earlier, where the Department of Healthcare Services had a significant amount of money to invest in asthma education and remediation across the state. And the Sierra Health Foundation funded about 26 organizations to start asthma control programs in their areas. And it was just a natural fit for us to partner with them and help train existing programs and new programs. So it's been a lot of networking, and it's been really great for the Academy. I hope, Kelly, this answers your question a little bit, maybe, or if there's any clarification. Great. Okay, Kelly, perfect.
Thanks, Ashley. So then another question we have. Yeah. Oh, thanks, Elena. How is the
competency another test? Question.
Go ahead.
I'm so sorry. How is the competency test, the teach back method, currently done? I'm sure with a platform like Zoom, there's a lot of challenges.
I can take that.
Thanks, Natalie.
Yeah, so everything is done over Zoom. For the teach back method, what CCV does is they break the all the participants into breakout rooms, and they practice the different medication devices. And there's a rubric that they follow so that they can see that they're doing it correctly. And so in these breakout rooms, there are about 3 to 4 participants for each one, and they practice doing the 5 different medication devices. We do have actual demonstration devices for the MDI and the DPI. And then, like I mentioned earlier, there are paper cutouts for the Twishaler, Fuxhaler, and I can't remember the last one. But because in person, before the pandemic, people got to touch the different devices. But since we have to do the virtual platform, then, CCV was very creative about using the paper cutouts for the medication devices that we don't have access to. this is good practice for the CHWs, the participants, because a lot of the asthma home visiting is virtual right now for some of the organizations. And so they get to practice doing that in Zoom, and then are able to do it in real life with their patients and clients with asthma. For the competency test, it's the same thing. It's done over Zoom. Even before the pandemic, it was actually phone-based. And the AEC has a rubric from AAE, the Association of Asthma Educators, that they use to test the participants. And it's mostly scenario-based, and some AECs also do the teach-back method to make sure that the CHWs can do that later on. I hope that answers your question. It is challenging for sure, but CHWs are doing their best on how to adapt.
So Natalie, I'm noticing that the next question in the chat is kind of similar, connected to that issue, if you want to take that one. Are these visits via Zoom now? Wondering if the data has changed since COVID in terms of the way CHWs conduct these visits versus previous in-person home visits, I assume is what they're asking about.
Yeah, so I think it varies for the different organizations. I know that some use Zoom, some use other platforms like Doximity, I think, because some organizations need to use platforms that are secure to protect the data, and and then sometimes it's phone-based. It depends on the location too. We've heard that there are organizations where their clients don't have great internet access, and so they'll use text and phone to do a lot of these home visits. And then there may be some organizations who are doing a little bit of in-person where they'll do it on like the porch or somewhere like that. But yeah, it varies. So I hope that answers your question.
Any other questions?
I don't see any more in the chat, Amy and Natalie.
Okay. Okay, so we have one more.
If you answered the question, Natalie, the training session, are they half-a-day training?
For the Asthma Management Academy, the trainings are actually 3 full days from 9 a.m. to 4 p.m. with a lunch hour break. And it equals to about 18 to 20 hours of training. So it's a really in-depth, comprehensive training for community health workers. One of the challenges is that working with organizations is they have to devote a lot of time to attending the Asthma Management Academy because it is 3 days long. I don't see any other questions. Any other questions?
Okay, I think we can move on. Yeah.
Yeah.
So in this next session, it's really about getting your feedback. As our asthma partners of California Breathing, we would love to hear your feedback about our evaluation of the asthma. We can then incorporate your important feedback into our future evaluation design and how we share evaluation data results. So please feel free to raise your hand in the function or just unmute yourself and speak, or write in the chat function your responses to these discussion questions. So the first one is, what are your overall impressions of these evaluation results? that we just shared today. Amazing, thank you. Any other comments? We can move on to the next question, which is, what would you like to see us evaluate in the asthma training that we are not already collecting? When someone else said, it's really great to see that the information learned in the asthma training is actually retained during a 3-month evaluation. Yeah, it's nice to have that follow-up. So are there any data that we're not yet evaluating that you're curious about?
Is it okay if I speak up? Hi,
Please.
it's Natalie.
Hi.
Thank you. Good afternoon. I'm from Boston with the Boston Public Health Commission. I just want to say this is fantastic. I also partnered with the Massachusetts Department of Public Health, and we do a 4-day training for community health workers who are doing this work. And I think this is amazing. I just wanted to see what California is doing. One thing I would love to see collected is to see if these individuals that went through the training, do they go to get certification to being like a certified asthma educator? Because I think it's pretty intensive, the training that they're receiving. Thank you.
Yeah, that's a really great idea to add that. And I'm not sure actually if that is known or collected kind of more informally through the partner agencies or through CCV. Anybody here on the call know if we know some of that? How many of our past participants have gone through that certification?
That'll be great. And also just to see if they got somewhat of a leadership role, they became, intern, they went through this, they are also training people that are coming in to do the same job or whatever. Are they seen as a senior leader, with the current role that they are in now?
I love that idea. Yeah, there's something like that of just kind of a follow-up on how this training has changed professionally, what people are doing, whether they get certified, whether they're in a leadership role. I love that idea. Thank you. Any other data ideas people have for changing things and adding things to our evaluation? One thing we've been thinking about is maybe collecting some data on referrals that people make, because for some asthma programs, they may only do a couple of the strategies, but in terms of really being a comprehensive asthma self-management education, maybe they refer out for home visits or refer out for tobacco cessation or something like that. So we're thinking about maybe collecting those data in the future. Looks like we have another in the chat. If possible, I would want to know some prescription fill data, and are more patients filling controller medications that were not in the past? Thank you, Lynn. Yeah, we actually, I believe that is part of the client asthma health outcome data that we shared today. So when we talk about the controller medication adherence, for some of the organizations that provide the data to us, they are actually looking at the data from medical records and pharmacy records on actually how many refills of their controller medications they're using. So that is part of that data for that particular indicator. I'm sure that if you're interested, Jackie could probably send you that particular piece of that overall indicator in terms of the improvement. And then from Lynn's previous question, what remediation organizations provide after conducting? I'm not sure what you mean, Ashley.
Oh, I think from answering Lynn's previous question, it might be a good idea to look at what remediation organizations are providing to clients after they conduct the environmental trigger assessment.
Oh, as something to evaluate.
Right.
Yes.
My
Okay.
summary didn't really capture that well, but yeah, just following up.
I got it now. Yeah. Okay.
Sorry about that.
No, that's great. Yeah, definitely a great thing to think about adding too. Yeah. So Marta, I would like to know what's the percentage of PCPs using or recommending the peak flow meter? Okay. So primary care providers. So we currently collect data on the participants of the AsMA, so it'd be the CHW, and we do ask about whether they talk about the peak flow with their clients. Don't know if we would be collecting about medical provider strategies used, or if that's something we get through, we really just get the patient outcome data through the organizations. So we, in the peak flow, as if you remember, was the least use of all the tools in the AsMA self-management education strategies. So it was about 17% who even mention it or talk about it in their teach backs. So we will be talking more about that issue of what providers, what medical providers do as part of their asthma control and services that they provide with their patients, such as if they use the peak flow meter. In our next webinar, it's about kind of the overall asthma control strategies, the strategic plan. So that is part of that in terms of more of the clinical services angle. You're welcome. Any other questions before we move on? All right, so we'll just ask one more question here in the discussion, which is, are there any other ways you'd like to see these evaluation data presented? Different formats or different types of graphs or things like that?
This might be a little bit challenging, Amy. I'm just wondering, is there a way of tracking seasonal trends? I know over here in Boston, you know, fall is happening now. We know winter is among us. So I'm pretty sure in California, it doesn't get that cold, but you know, there are some weather conditions that we know is a huge trigger for any, you know, people with asthma. So I wonder if that's something that you could evaluate or just follow, because that's one of the questions too that we want to know, like what's the worst season for that individual.
That's a really great idea. Yeah, we haven't done that yet, but I love that idea. And just we could just, you know, evaluate the data depending on when it was collected. Mm-hmm.
Yeah, thank you. And I think that's actually something that we can do, because from the organizations, and I believe Amy or Natalie, you said this earlier, we do ask organizations share patient or client level data with us for several years, so that we're able to look, since we know that asthma is episodic and that it changes over time, so that we can look at trends over time. And so it would be good to break it down by seasons. For sure, that's a great suggestion. Thank you.
Any other questions or comments about the program, the training series in general, or how we evaluate it. Really appreciate all this engagement today. Thank you, Nana. All right, well, I guess we'll move on. Thank you again so much for all that feedback and really great ideas for future evaluation. We'll definitely take all of that into consideration in our next evaluation planning and design. Really appreciate it. So in general, we also just want to acknowledge all the folks that make this even possible. So thank you to all who make the Asthma Management Academy possible. We have Comité Cívico del Valle, our training partners, the asthma participants themselves, the asthma partner organizations, the Asthma Mitigation Project, which we discussed earlier, all the certified asthma educators who come and take part in the training and also do the competency testing, and the Association of Asthma Educators, and Centers for Disease Control and Prevention, which is how we're funded. Next slide. So thank you so much, everybody, for attending. And yes, we will be able to share the presentation as well as the recording that will be available. And also I want to remind everybody before you leave to please fill out the survey, or when you leave, it will pop up. And so please fill out that survey at the end of the webinar. And also to remind you to join us for that third webinar we just discussed, where we will be talking about some of the clinical strategies. And that is called the Assessment of Asthma Control Strategies. It is the third of the 3 in this webinar series, and that will be on November 16th, same time, 10:30 a.m. to 12 p.m. Pacific. And also for more information, you can email us at california.breathing@cdph.ca.gov. And you can also visit us at www.cdph.ca.gov/ASMA.